your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the 3rd trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing. Introduction. Greet your viewers warmly. Briefly share your excitement about documenting your pregnancy journey. Week 4-6. Discovery. Discuss how you found out about the pregnancy. Share your initial thoughts and emotions. Week 7-10. First trimester symptoms. Detail common symptoms like morning sickness and fatigue. Offer tips on coping with these symptoms. Week 11-13. First ultrasound. Share your experience with the first ultrasound. Discuss any surprises or emotions during this appointment. Week 14-16. Gender reveal. If you've discovered the gender, reveal it to your audience. Share any creative or special gender reveal ideas you used. Week 17-20. Second trimester milestones. Discuss improvements in symptoms. Share any notable milestones, like feeling the first kicks. Week 21-24. Maternity fashion. Showcase your favorite maternity outfits. Offer tips for staying stylish and comfortable. Week 25-28. Baby shower preparation. Discuss planning and organizing your baby shower. Share any memorable moments from the celebration. Week 29-32. Third trimester challenges. Address common challenges like back pain and sleep difficulties. Offer advice on staying comfortable during this stage. Week 33-36. Nesting and preparing. Show your audience how you're preparing for the baby's arrival. Discuss any nesting instincts or rituals you've experienced. Week 37-40. Final countdown. Share your thoughts and emotions as you approach your due date. Discuss any last-minute preparations or anxieties. Labor and delivery. Document your labor experience as much as you're comfortable. Share your feelings and reactions during the delivery. Welcome baby. Postpartum. Introduce your newborn to your audience. Discuss your postpartum experiences and emotions. Conclusion. Express gratitude to your viewers for joining you on this journey. Share your plans for future videos or updates on your growing family.
C-Section Recovery Guide, 20 Essential Tips for New Moms. 1. Introduction. Start by welcoming viewers and acknowledging the commonality of C-sections in childbirth. 2. Immediate post-op care. Discuss the importance of following medical advice for wound care and pain management. Highlight the significance of rest and limited physical activity in the initial days. 3. Incision care. Explain how to clean and care for the incision site. Stress the significance of keeping the incision dry and watching for signs of infection. 4. Pain management. Talk about prescribed pain medications and their proper usage. Suggest non-pharmacological methods like using a heating pad or practicing deep breathing exercises. 5. Activity guidelines. Emphasize the need for gradual reintroduction of daily activities. Recommend avoiding heavy lifting and strenuous exercise until approved by a healthcare professional. 6. Nutrition and hydration. Highlight the importance of maintaining a healthy diet for recovery. Encourage staying hydrated to aid in healing. 7. Monitoring postpartum bleeding. Discuss what is considered normal postpartum bleeding and when to seek medical attention. 8. Emotional well-being. Address the emotional aspects of recovery and potential postpartum emotions. Encourage open communication with healthcare providers about mental health concerns. 9. Follow-up appointments. Stress the importance of attending post-operative checkups. Explain what to expect during these appointments and how healthcare providers monitor recovery. 10. Support system. Discuss the role of family and friends in providing support. Emphasize the importance of seeking help when needed. 11. Breastfeeding after C-section. Offer guidance on breastfeeding positions that are comfortable post-surgery. Highlight the benefits of breastfeeding for both the mother and baby. 12. Scar massage. Introduce scar massage as a technique to promote healing and reduce scar tissue. Demonstrate gentle massage techniques. 13. Resuming intimacy. Discuss the importance of waiting until physically and emotionally ready. Provide tips for comfortable intimacy post-C-section. 14. Postpartum exercise guidelines. Explain when it's safe to start postpartum exercises. Offer examples of gentle exercises to aid in recovery. 15. Birth control options. Discuss contraceptive options suitable for post-C-section recovery. Encourage discussions with healthcare providers about family planning. 16. Warning signs. Outline potential complications and the importance of recognizing warning signs. Stress the need to seek immediate medical attention for any concerning symptoms. 17. Scar appearance. Address common concerns about the appearance of the scar. Provide reassurance that scars tend to fade over time. 18. Returning to work. Discuss factors to consider when planning a return to work. Emphasize the importance of balancing work responsibilities with ongoing recovery needs. 19. Long-term care considerations. Mention the potential for future pregnancies and how that may impact the C-section scar. Discuss any long-term considerations or precautions advised by healthcare professionals. 20. Conclusion. Summarize key points. Encourage viewers to consult with their healthcare providers for personalized advice. Remember to tailor the script to your audience and provide a disclaimer to consult with healthcare professionals for personalized advice. 10 best foods for boosting fertility in women. Introduction. Greet your audience and introduce the topic. Mention the importance of nutrition in fertility. Point 1. Fruits and vegetables. Highlight the benefits of vitamins, minerals, and antioxidants. Provide examples of fertility-friendly fruits and vegetables. Point 2. Leafy greens. Emphasize the role of folate in reproductive health. Recommend specific leafy greens like spinach and kale. Point 3. Whole grains. Discuss the benefits of complex carbohydrates and essential nutrients. Suggest whole grains such as quinoa, brown rice, and oats. Point 4. Lean proteins. Explain the importance of protein without excess saturated fats. Recommend sources like poultry, fish, and plant-based proteins. Point 5. Nuts and seeds. Highlight the nutritional value of healthy fats, protein, and minerals. Name specific nuts and seeds beneficial for fertility. Point 6. Fatty fish. Discuss the role of omega-3 fatty acids in promoting fertility. Recommend fish options like salmon, mackerel, or sardines. Point 7. Dairy or alternatives. Stress the significance of calcium and vitamin D for reproductive health. Suggest dairy products or alternatives like fortified plant-based milk. Point 8. Avocado. Talk about the benefits of monounsaturated fats and folate in avocados. Provide creative ways to incorporate avocados into the diet. Point 9. Berries. Discuss the antioxidant-rich nature of berries. Name specific berries like blueberries and strawberries. Point 10. Water. Explain the importance of staying hydrated for overall health and fertility. Encourage viewers to prioritize water intake. Conclusion. Summarize key points. Invite viewers to share their thoughts or ask questions in the comments. Remember to engage your audience, maintain a conversational tone, and include any additional information or personal anecdotes that can enhance the video.
7 weeks pregnant, your baby's development. Although your baby's brain development will continue long after birth, the basic sections have formed. As the week progresses, the digestive system and lungs are also developing. Tiny facial features are also starting to take shape, and each little arm now has a paddle-shaped hand attached to it. Another important development this week is the formation of the umbilical cord. This cord creates a connection between you and your developing baby throughout your pregnancy that allows nutrients and oxygen to flow between you and also eliminates your baby's waste. If you have a prenatal checkup scheduled for this week or sometime soon, and have an ultrasound exam, you may have an opportunity to see and hear something amazing, a heartbeat. Don't worry if this isn't in your healthcare provider's plans quite yet. The size of the embryo at 7 weeks pregnant. Your little one is growing fast. At 7 weeks, the embryo is about the size of a small blueberry, about 0.3 inch long. For a visual idea of how things are developing inside your uterus this week, check out this illustration: placenta, yolk sac, embryo, amniotic sac, uterus, cervix. Mom's body at 7 weeks pregnant. The pregnancy signs and symptoms you may have experienced in the past weeks will probably continue, and some of them may become more pronounced this week. Although these symptoms can be tiring and annoying, keep in mind that you're just a few weeks away from your second trimester, when many of these symptoms may subside. One symptom you may be experiencing around this week of pregnancy is frequent urination. Hormonal changes and increased blood volume are to blame for this. Now that there's more fluid in your system, it means more for your kidneys to process, and as a result, more urine is produced. 7 weeks pregnant, your symptoms. At 7 weeks pregnant, here are some of the symptoms you may be experiencing. Excess salivation. You may notice more saliva than usual, often accompanying the nausea and vomiting of morning sickness. It may feel weird, but this is just another strange, yet normal part of pregnancy for many women. Food cravings or aversions. Feel like pickles and chocolate for dinner? Can't stand the smell of eggs even though it never used to bother you? Your food preferences and tolerance for odors may change during this time, and these changes are most likely caused by hormones. If you find yourself craving any non-food items, like dirt or chalk, talk to your healthcare provider right away. Nausea. Of all of this week's symptoms, morning sickness can be the worst. It's often in full effect at this stage, and it can make you feel absolutely miserable. Luckily, for many women it's likely to disappear during the second trimester. Diarrhea. As if you needed another trip to the bathroom at 7 weeks, diarrhea is usually nothing to worry about. It may be one of the gastrointestinal symptoms, like constipation or indigestion, that you might experience due to fluctuating hormones. Try adding foods like applesauce, oatmeal, and bananas to your diet to help absorb any excess water, and stay hydrated, as diarrhea can lead to dehydration. Spotting. Light spotting at 7 weeks pregnant is considered normal, especially after sex. If you notice heavier bleeding, call your healthcare provider. Cramping. If you feel mild cramps, what you're experiencing is quite normal. Your uterus is expanding, so some discomfort is to be expected. If the cramping is severe or long-lasting, or if you feel pain other than cramping, call your healthcare provider. Fatigue. You may continue to feel exhausted this week. Your levels of the hormone progesterone are quickly increasing, and it's this hormone that can make you feel sleepy.
Understanding common causes of poor egg quality. Intro. Hello everyone. Welcome back to our channel. Today we'll be diving into a crucial topic for those navigating fertility and reproductive health: the common causes of poor egg quality. If you're new here, don't forget to subscribe and hit the notification bell so you never miss out on valuable information. Let's jump right in. 1. Age. As we age, the quality of our eggs naturally declines. Advanced maternal age is a significant factor in poor egg quality. 2. Hormonal imbalances. Imbalances in hormones, such as FSH and LH, can impact egg quality. Maintaining hormonal balance is crucial for optimal fertility. 3. Smoking. Smoking is known to accelerate the depletion of ovarian reserve and negatively affect egg quality. Quitting smoking can positively impact fertility. 4. Poor diet. A nutrient-rich diet is essential for reproductive health. Lack of key vitamins and minerals can compromise egg quality. Focus on a well-balanced diet. 5. Obesity. Being overweight can disrupt hormonal balance and affect egg quality. Maintaining a healthy weight is vital for fertility. 6. Underweight. Conversely, being underweight can also impact fertility. Adequate nutrition is essential for optimal egg development. 7. Environmental toxins. Exposure to environmental toxins, such as pollutants and chemicals, can negatively affect egg quality. Minimize exposure whenever possible. 8. Stress. Chronic stress can disrupt hormonal balance and impact reproductive health. Incorporating stress management techniques is crucial for fertility. 9. Alcohol consumption. Excessive alcohol intake can be detrimental to egg quality. Moderation is key when it comes to alcohol consumption during fertility journeys. 10. Lack of exercise. Regular exercise promotes overall health, including reproductive health. Sedentary lifestyles may contribute to poor egg quality. 11. Ovulation disorders. Irregular ovulation patterns or disorders can lead to poor egg quality. Seeking medical advice for irregular cycles is important. 12. Genetic factors. Some individuals may have genetic predispositions that affect egg quality. Genetic counseling can provide valuable insights. 13. Polycystic ovary syndrome, PCOS. PCOS can impact hormonal balance and egg development. Managing PCOS through lifestyle changes and medical interventions is crucial. 14. Endometriosis. Endometriosis can affect egg quality by causing inflammation. Seeking treatment for endometriosis is essential for fertility. Thyroid disorders. Thyroid imbalances can impact reproductive health. Regular thyroid monitoring and management are important for optimal fertility. Diabetes. uncontrolled diabetes can affect egg quality. Managing blood sugar levels is crucial for individuals with diabetes trying to conceive. Autoimmune disorders. Some autoimmune disorders can affect fertility. Consultation with a specialist is recommended for those with autoimmune conditions. Poor egg reserve. Low ovarian reserve can contribute to poor egg quality. Regular fertility assessments can help understand and address this issue. Infections. Untreated infections can negatively impact reproductive organs and egg quality. Prompt medical attention is important. Medication side effects. Some medications may have side effects that affect fertility. Consult your healthcare provider if you have concerns about medications and fertility. Outro. That wraps up today's video on the common causes of poor egg quality. If you found this information helpful, don't forget to give it a thumbs up and share it with others who might benefit. Remember, every fertility journey is unique, and seeking professional advice is crucial. Until next time, stay informed and take care of your reproductive health. Thanks for watching.
"6 weeks pregnant, your little one is developing new features." This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantoliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry.
Unlocking the secret to boost female fertility. Top 20 foods for improved egg quality. Introduction. Hello everyone. Welcome back to our channel. Today, we have an incredibly important topic to discuss, something that many women may find valuable on their fertility journey. We'll be diving into the top 20 foods that can significantly enhance female egg quality. If you're ready to unlock the secret to boosting your fertility, stay tuned. Segment 1: Importance of female egg quality. Before we get into the list, let's understand why female egg quality is crucial for conception. The quality of your eggs plays a pivotal role in fertility, affecting not just the likelihood of conception, but also the health of the baby. Now, let's jump into the first set of foods that can make a positive impact. Segment 2: Dark leafy greens. Our number 1 on the list is dark leafy greens such as spinach and kale. Packed with essential nutrients like folate and iron, these greens promote optimal egg development and overall reproductive health. Add a generous serving of these greens to your diet for a fertility boost. Segment 3: Berries. Next up, we have berries. Blueberries, strawberries, and raspberries. Loaded with antioxidants, these little powerhouses protect your eggs from oxidative stress, enhancing their quality. Snack on a handful of berries daily to give your fertility a sweet and nutritious kick. Segment 4: Avocado. Moving on to number 3, avocados. Rich in monounsaturated fats and vitamin E, avocados support hormonal balance and nourish your reproductive system. Incorporating avocados into your diet can positively impact your egg quality over time. Segment 5: Fatty fish. Let's talk about fatty fish like salmon and mackerel, omega-3. Fatty acids found in these fishes are essential for reproductive health. They not only improve egg quality, but also contribute to a healthy pregnancy. Aim for at least 2 servings of fatty fish per week. Segment 6: Nuts and seeds. Nuts and seeds come in at number 5. Almonds, walnuts, and flax seeds are rich in omega-3s and antioxidants, promoting better egg quality. Snacking on a handful of these daily can be a simple yet effective way to boost your fertility. Segment 7: Quinoa. Quinoa takes the 6th spot on our list. This whole grain is a fantastic source of protein and essential amino acids, supporting overall reproductive health. Swap out refined grains for quinoa to give your body the nutrients it needs for optimal eggs quality. Segment 8: Greek yogurt. Number 7 is Greek yogurt. Packed with protein and probiotics, Greek yogurt promotes a healthy gut, positively influencing your reproductive system. Choose the unsweetened variety for maximum benefits. Segment 9: Broccoli. Broccoli, our 8th contender, is rich in folate and other crucial nutrients. It aids in regulating hormones and supporting healthy egg development. Steam or stir-fry broccoli as a tasty and nutritious side dish to boost your fertility. Segment 10: Lean protein. Lean protein sources like chicken and turkey make it to number 9. Protein is essential for overall health, and incorporating lean sources into your diet helps provide the necessary building blocks for optimal egg quality. Segment 11: Eggs. It might sound cliche, but eggs are our number 10. They are a fantastic source of high-quality protein, choline, and antioxidants. Including eggs in your diet can contribute to improved egg quality over time. Segment 12: Citrus fruits. Let's move on to number 11, citrus fruits like oranges and grapefruits. Packed with vitamin C, these fruits support the production of collagen, a crucial component for healthy eggs. Add a citrusy twist to your diet for a fertility boost. Segment 13: Pumpkin seeds. Pumpkin seeds claim the 12th spot on our list. These tiny seeds are rich in zinc, a mineral essential for reproductive health. Snacking on pumpkin seeds can contribute to better egg quality and hormonal balance. Segment 14: Beans and lentils. Beans and lentils come in at number 13. These plant-based protein sources are high in fiber and essential nutrients, supporting hormonal balance and reproductive health. Incorporate a variety of beans and lentils into your meals. Segment 15: Sweet potatoes. Number 14 is sweet potatoes. Packed with beta-carotene and vitamin A, sweet potatoes support healthy egg development. Swap regular potatoes for the sweet variety to enhance your fertility. Segment 16. Tomatoes. Tomatoes take the 15th spot. Rich in lycopene, an antioxidant, tomatoes support reproductive health by protecting eggs from damage. Add fresh tomatoes to your salads or enjoy them in cooked dishes. Segment 17. Asparagus. Asparagus claims the 16th spot. This green veggie is loaded with folate, promoting optimal egg quality and hormonal balance. Steam or roast asparagus for a delicious and fertility-boosting side dish. Segment 18. Beets. Beets at number 17 are rich in nitrates and antioxidants. They support blood flow to the reproductive organs, positively influencing egg quality. Incorporate beets into your diet for a natural fertility boost. Segment 19. Lean red meat. Lean red meat makes it to number 18. Rich in iron and zinc, red meat supports overall reproductive health. Choose lean cuts and enjoy them in moderation to enhance your fertility. Segment 20. Water. Last but not least, staying hydrated is crucial for optimal fertility. Drinking enough water ensures proper circulation, supporting the delivery of nutrients to the reproductive organs. So, don't forget to keep yourself well hydrated throughout the day. Conclusion. And there you have it, the top 20 foods to improve female egg quality. Remember, making these dietary changes is a journey, and consistency is key. If you found this video helpful, give it a thumbs up, and don't forget to subscribe for more valuable content. Wishing you all the best on your fertility journey. Until next time, take care. Outro. Thank you for watching, and we'll see you in the next video. Stay healthy and happy.
Intro. Hey there, amazing viewers. Welcome back to our channel. Today, we have a topic that's close to the heart, pregnancy and self-care tips. Whether you're expecting, planning to be, or just curious, you're in for a treat. Stick around for the top 15 points that'll make your pregnancy journey a breeze. Point 1. Mindful nutrition. First up, let's talk about nourishing yourself and your little one. Opt for nutrient-rich foods, plenty of fruits and veggies, and don't forget that hydration game. Point 2. Gentle exercises. Next on the list is staying active, but no need for intense workouts. Gentle exercises like prenatal yoga or a simple stroll can do wonders for your well-being. Point 3. Beauty of rest. Ah, the beauty of rest. Embrace those power naps and full night's sleep. Your body and mind will thank you. Trust me. Point 4. Emotional wellness. It's okay to have mixed emotions. Prioritize your emotional well-being, whether through journaling, meditation, or just having heart-to-heart talks. Point 5. Pamper yourself, pamper time, treat yourself to a relaxing bath, a prenatal massage, or whatever makes you feel like the queen you are. Point 6. Support system. Surround yourself with positivity. Your support system is crucial. Friends, family, or fellow mom-to-be pals. Point 7. Educate yourself. Knowledge is power. Educate yourself about the beautiful journey you're on. Attend prenatal classes, read books, and absorb all the information. Point 8. Regular checkups. Speaking of information, regular checkups are a must. Keep track of your and your baby's health with those scheduled visits to your healthcare provider. Point 9. Fashionable comfort. Who says you can't be fashionable and comfortable? Invest in maternity, wear that makes you feel good and accommodates that growing belly. Point 10. Hygiene essentials. Pay extra attention to hygiene. A healthy baby. It's the little things that count. Point 11. Positive affirmations. Daily affirmations are like a power boost for your mindset. Remind yourself of the amazing journey you're on and the incredible mom you're becoming. Point 12. Create memories. Capture those beautiful moments. Whether it's through a pregnancy photo shoot or a simple diary, create memories that'll last a lifetime. Point 13. Delegate tasks. Don't be shy to ask for help. Delegate tasks and focus on what truly matters, your well-being and your baby's. Point 14. Stay flexible. Plans might change, and that's okay. Stay flexible and adapt to the beautiful uncertainties of this journey. Point 15. Celebrate milestones. Last but not least, celebrate the milestones. Every kick, every ultrasound, it's all part of your incredible story. Outro. And there you have it, the top 15 points for a happy and healthy pregnancy. If you enjoyed this video, don't forget to give it a thumbs up, subscribe, and hit that notification bell. Until next time, take care of yourself and that precious bump. Sending lots of love.
Baby development X. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of 1 chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing in amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing, and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough calcium. Since your baby's bones are beginning to ossify, calcium is more important than ever.
A prenatal supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of preeclampsia. Talk to your doctor if you think you're gaining too many pounds. Keep a healthy diet. You've probably made some healthy dietary changes in the previous weeks, and your 15 weeks pregnant diet should stay healthy. This will help you avoid excessive weight gain. Stay safe. Although it's advisable to exercise during your pregnancy, 15 weeks pregnancy precautions include avoiding contact sports or sports that carry a risk of falling, like horse riding. Go to the dentist. It might not be pleasant, but taking care of your teeth can actually lead to a healthier pregnancy. Women who develop gingivitis during pregnancy have a higher risk of complications, including preterm birth. Second trimester pregnancy symptoms at 15 weeks. Your pregnancy symptoms may include swollen and bleeding gums, pains on the side of your belly, caused by your expanding womb, known as round ligament pains, headaches, nosebleeds, feeling bloated, indigestion and heartburn, sore breasts, leg cramps, feeling hot, dizziness, swollen hands and feet, urine infections, vaginal infections, darkened skin on your face or brown patches. This is known as cloasma or the mask of pregnancy. Greasier, spotty skin, thicker and shinier hair. You may also experience symptoms from earlier weeks, such as morning sickness, a heightened sense of smell, mood swings, a white milky pregnancy discharge from your vagina and light spotting. Seek medical advice for any bleeding.
Introduction, greetings and welcome. Mention the importance of a healthy diet during pregnancy. Point 1, balanced diet. Emphasize the need for a well-balanced diet. Include a variety of food groups, fruits, vegetables, whole grains, proteins, and dairy. Highlight the importance of getting essential nutrients from different sources. Point 2, folic acid and iron. Discuss the significance of folic acid in preventing birth defects. Mention good sources of folic acid, leafy greens, citrus fruits. Fortified cereals. Highlight the importance of iron for preventing anemia during pregnancy. Include iron-rich foods, lean meats, beans, spinach, and fortified cereals. Point 3, omega-3 fatty acids. Explain the benefits of omega-3 fatty acids for the baby's brain development. Include sources of omega-3s. Fatty fish like salmon, chia seeds, flax seeds, walnuts. Point 4, adequate hydration. Stress the importance of staying hydrated during pregnancy. Recommend water as the primary beverage. Limit caffeine intake and avoid sugary drinks. Point 5, calcium for bone health. Discuss the need for calcium in supporting the baby's bone development. Include good sources of calcium, dairy products, fortified plant-based milk, leafy greens. Point 6, small, frequent meals. Suggest eating smaller, more frequent meals to ease digestion. Emphasize the importance of snacks with a balance of nutrients. Point 7, foods to avoid. List foods that should be avoided during pregnancy: raw fish, unpasteurized dairy, excessive caffeine, etc. Explain the reasons behind these restrictions for the baby's safety. Conclusion, recap the key points. Encourage consulting with a healthcare provider for personalized advice. Invite viewers.
Introduction. Emphasize the transformative journey of pregnancy. Discuss the emotional and physical changes women experience. Calculating weeks. Clarify that the LMP method is a standard for tracking pregnancy. Note that not all months have the same number of days, so weeks may not align perfectly. Month-to-week conversion. Break down weeks further, explaining the significance of each week. Highlight milestones like the baby's heartbeat starting around week 6. Trimesters. Detail major developments in each trimester, such as organ formation and fetal movement. Discuss common symptoms and changes experienced by the mother. Due date calculation. Explain the Naegele's rule for estimating the due date. Stress the importance of ultrasounds for accurate dating and monitoring fetal growth. Common pregnancy terms. Elaborate on terms like term, preterm, and postterm. Discuss the potential challenges and care associated with preterm births. Tips for tracking. Recommend apps that provide daily insights and tips. Suggest creating a pregnancy journal to document experiences and questions for healthcare providers. Closing. Reinforce the uniqueness of each pregnancy journey. Express support for viewers going through this experience. Disclaimer: emphasize that the provided information is general and may not cover specific cases. Encourage seeking professional advice for personalized guidance. Call to action: ask viewers to share their pregnancy stories or questions. Remind them to consult healthcare providers for accurate and personalized information.
Fast track to fertility, expert tips from a leading doctor. 1. Introduction. Welcome viewers. Today we're sharing the top 20 tips to boost fertility and increase your chances of getting pregnant fast. 2. Healthy lifestyle. Maintain a healthy lifestyle with a balanced diet and regular exercise to support overall well-being. 3. Nutrient-rich foods. Focus on nutrient-rich foods, including fruits, vegetables, whole grains, and lean proteins to enhance fertility. 4. Hydration. Stay well hydrated by drinking plenty of water, promoting optimal reproductive health. 5. Limit caffeine and alcohol. Reduce caffeine and alcohol intake, as excessive consumption can impact fertility. 6. Maintain a healthy weight. Achieve and maintain a healthy weight, as both underweight and overweight conditions can affect fertility. 7. Regular exercise. Engage in regular moderate exercise, which can positively influence reproductive health. 8. Balanced hormones. Ensure hormonal balance through a healthy lifestyle and, if needed, consult with a doctor for guidance. 9. Quit smoking. Quit smoking as it has detrimental effects on fertility and reproductive organs. 10. Stress management. Practice stress management techniques such as meditation, yoga, or deep breathing to reduce stress levels. 11. Regular checkups. Schedule regular checkups with a fertility specialist to monitor reproductive health. 12. Know your cycle. Understand your menstrual cycle to identify your most fertile days and optimize conception timing. 13. Tracking ovulation. Use ovulation prediction kits or apps to track ovulation accurately for better timing. 14. Position matters. Experiment with different sexual positions to increase the chances of sperm reaching the egg. 15. Optimal timing. Be consistent with intercourse during the fertile window to maximize the chance of conception. 16. Sperm health. Encourage sperm health by avoiding hot tubs, tight underwear, and excessive heat exposure. 17. Preconception supplements. Consider taking preconception supplements like folic acid to support a healthy pregnancy. 18. Limit exposure to harmful substances. Minimize exposure to environmental toxins and chemicals that may affect fertility. 19. Fertility-friendly lubricants. Use fertility-friendly lubricants that do not hinder sperm movement. 20. Patience and emotional support. Be patient and seek emotional support during the fertility journey, understanding that it may take time. Conclusion: thank you for watching. Implementing these tips can significantly boost your chances of getting pregnant fast. Remember, consulting with a fertility specialist is crucial for personalized advice.
10 healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
Eight weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing, the internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks pregnant. Your baby has already come a long way, and soon, growth will speed right up. Your little one is about the size of a raspberry this week, just 0.5 to 0.6 inch long, crown to rump. Mom's body at 8 weeks pregnant. By the time you're 8 weeks pregnant, pregnancy symptoms will be in full swing. Your clothes may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant, thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours. Or is accompanied by any other symptoms. And do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis. Light spotting. Spotting, a few drops of blood at a time, can be normal. However, be sure to talk to your healthcare provider if you feel at all concerned and call right away if you notice heavier bleeding. Fatigue. Your progesterone levels are increasing, which can often leave you feeling more tired than usual. Go ahead and grab some extra snooze time whenever you can. If you're feeling exhausted, listen to your body and try to take it easy. Trouble sleeping. Changing hormone levels, discomfort, and extra trips to the restroom often add up to disturbed sleep. Try listening to peaceful music or reading a book if you're feeling wide awake. You can also try drinking warm milk or taking a shower or bath before bed. Some women find lying on their left side is helpful as it improves blood circulation. Placing a pillow between your knees may help you feel more comfortable too.
Balancing Act, a guide for pregnant working women. Managing work while being pregnant can be a challenging but manageable experience. Here are some tips for pregnant women who are also working. 1. Communication with your employer. Inform your employer about your pregnancy in a timely manner. This allows them to make any necessary adjustments and accommodations. Discuss your plans for maternity leave and ensure you understand your company's policies regarding pregnancy and parental leave. 2. Schedule regular prenatal checkups. Attend all necessary prenatal appointments to ensure the health of both you and your baby. Communicate with your employer about these appointments in advance and discuss any necessary time off. 3. Flexible work arrangements. If possible, explore flexible work options such as telecommuting or adjusting your work hours to accommodate your changing needs and energy levels. 4. Take breaks and rest. Listen to your body and take breaks when needed. Short breaks can help alleviate fatigue and stress. Ensure you have a comfortable chair and workspace to support your changing body. 5. Stay organized. Use tools like calendars, planners, or apps to stay organized and manage your workload efficiently. Prioritize tasks and focus on what's most important to reduce stress. 6. Delegate tasks. If you have the opportunity, delegate tasks that can be handled by others. This can help lighten your workload and reduce stress. 7. Stay hydrated and eat well. Proper nutrition is crucial during pregnancy. Stay hydrated and eat balanced, healthy meals to maintain your energy levels. 8. Seek support from colleagues. Let your colleagues know about your pregnancy, especially if it may affect your work in any way. They can provide support and understanding. 9. Create a comfortable workspace. Make your workspace more comfortable by adding cushions or ergonomic accessories as needed. 10. Know your rights. Familiarize yourself with your rights as a pregnant employee. Understanding your legal protections can help ensure fair treatment in the workplace. 11. Plan for maternity leave. Work with your employer to plan for your maternity leave. Make sure you understand how your role will be covered during your absence. Remember, it's essential to prioritize your health and the health of your baby during this time. Don't hesitate to communicate openly with your employer, seek support from your colleagues, and make adjustments as needed to manage the demands of both work and pregnancy.
9 weeks pregnant. Your baby's development. This week, your little one, now officially known as a fetus, is looking less and less like a little pink blob and instead has more of a mini baby shape. Even the tail that had been present in earlier weeks has almost disappeared. Tiny facial features continue to develop this week, including a more prominent nose and eyelids. Up top, the head is large compared to the body, while down below, little toes are now visible. Internal organs are also forming, including the digestive and reproductive systems, meaning that the intestines as well as testes or ovaries are growing. Now that you're 9 weeks pregnant, your little one may be starting to move, thanks to some recent muscle development. But you'll have to wait until sometime in the second trimester to actually feel these movements. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. 9 weeks pregnant, your symptoms. At 9 weeks pregnant, here are some of the symptoms you may be experiencing. Growing waistline. Your belly at 9 weeks pregnant may not have a pronounced, rounded look, but your pre-pregnancy clothes are probably feeling a little snug due to a combination of a thickening waistline and some bloating brought on by your old friends, pregnancy hormones. Spotting. You may see some spotting in the first trimester, Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. If you haven't experienced morning sickness by now, you could be one of the lucky ones who will avoid this common symptom. But if you do get morning sickness, keep on eating smaller meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need to add about 300 calories to your daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, you may find yourself sleepier than usual. Rest as much as you can during the day, particularly if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world one minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Frequent urination. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Don't drink less water, as staying hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born. "11 weeks pregnant, your baby's development." From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common. Between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention. However, if you crave non-food items like clay or dirt, contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, contact your healthcare provider to rule out problems. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress, and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. You might experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces. Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients and antibodies from your blood supply to your baby. From now on, your baby is going to grow. Even though you can't feel it yet, your baby is moving, waving and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes. If you poke your 12-week pregnant belly while looking at baby on an ultrasound, you'll likely see movement. If you're 12 weeks pregnant with twins, your twosome is developing at a similar rate as singleton babies at 12 weeks. Later on, they'll have a slightly slower rate of growth. Early pregnancy symptoms at 12 weeks. Your signs of pregnancy may include an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, light spotting, see your doctor if you get bleeding in pregnancy, cramping, a bit like period pains, Darkened skin on your face or brown patches, this is known as chloasma or the mask of pregnancy. Greasier, spotty skin. Thicker and shinier hair. Bloating and the feeling of being bloated.
"14 weeks pregnant. Your baby's development. Welcome to your second trimester. Your little one is trying out some new moves this week. Your baby's eyes are starting to move, and those little legs and arms are starting to flex. These movements also allow your baby to practice the important skill of moving hands to mouth. The senses of smell and taste are also developing, and your baby's skin is thickening too. You'll have to wait and see if your baby will be born with a full head of hair or not, but right now, hair follicles are forming under the surface of the skin. With each passing week, your baby is looking more and more like the little person you'll meet the day you give birth. By now, or very soon, the genitals are fully developed. But it's still too early to know whether you're having a boy or a girl. How big is my baby at 14 weeks? At 14 weeks, your baby is growing and developing rapidly, measuring between 3.5 and 4 inches long and weighing around 2 ounces, about the size of a navel orange. The size of the fetus at 14 weeks pregnant. At 14 weeks, the fetus is roughly the size of a nectarine. Around this time, the average fetus weighs about 1.5 ounces and can measure up to 3.5 inches long, crown to rump. Making faces. Thanks to brain impulses, your baby's facial muscles are getting a workout. Those tiny features can squint, frown, and grimace. Your baby is also making sucking and chewing movements. Growing hair. Soft baby hair is coming. Hair follicles have started to form deep in your baby's skin. Around 20 weeks, fine downy hair will sprout from these follicles on your baby's eyebrows, upper lip, and chin. Your active baby. Though you can't feel those tiny punches and kicks yet, your baby is quite active and has flexible hands and feet. Mom's body at 14 weeks pregnant. You've finally reached the second trimester. Pregnancy symptoms during week 14. No more morning sickness? Your energy is likely returning, and your queasiness may have eased by now. If not, hang on, chances are good that morning sickness will soon be behind you if it's not already. Although it's uncommon, some expecting moms will still feel nauseated months from now. Tell your healthcare provider at your next appointment if you're still having nausea or vomiting. Starting to show. The top of your uterus is a bit above your pubic bone, which may be enough to push your tummy out a tad. Starting to show can be quite a thrill, giving you and your partner visible evidence of the baby you're waiting for. Bleeding gums. About half of pregnant women have swollen, red, tender gums that bleed when flossed or brushed. This gum inflammation, called pregnancy gingivitis, is partly caused by hormonal changes that make your gums more sensitive to the bacteria in plaque. Be sure to brush your teeth twice daily, and floss daily. Round ligament pain. On either side of your uterus, you have two ligaments that stretch and thicken to accommodate your growing belly. These changes may cause round ligament pain. It can feel like a short, stabbing pain in response to movement, or a dull ache after an especially active day. If round ligament pain strikes, try to stop and rest, pay attention to your posture, change positions, gently massage the area, or take a warm bath. Some women find that wearing a maternity belt for extra support helps relieve the pain. Increased appetite. Pregnancy hunger starts and peaks in the second trimester. Your body is working hard to support your baby, and that requires plenty of energy. Your meals are also fueling your body's pregnancy changes, which include a much higher blood volume, your growing breasts and uterus, and increased fat stores. You need an extra 300 to 350 calories per day in the second trimester. Round ligament pain. For some women, a possible side effect of uterine growth is what your OB/GYN would call round ligament pain. Basically, these are pregnancy growing pains that feel like achy or sharp pains on one or both sides of the abdomen. That begin to appear around 14 weeks but can strike at any time during the second trimester. Here's why. The uterus is supported by thick bands of ligaments that run from the groin up the side of the abdomen. As your uterus grows, the supporting ligaments stretch and thin out to accommodate the increasing weight. This weight pulls on the ligaments and causes a sharp pain or a dull ache in your lower abdomen. It's often more noticeable when you change positions suddenly or quickly get up from sitting or lying down, or when you cough or sneeze. The best way to bring relief? Put your feet up and rest in a comfortable position, which should ease the strain and the pain. Baby development at 15 weeks. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of one chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing an amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing, and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough calcium. Since your baby's bones are beginning to ossify, calcium is more important than ever. A prenatal supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of preeclampsia. Talk to your doctor if you think you're gaining too many pounds. Keep a healthy diet. You've probably made some healthy dietary changes in the previous weeks, and your 15 weeks pregnant diet should stay healthy. This will help you avoid excessive weight gain. Stay safe. Although it's advisable to exercise during your pregnancy, 15 weeks pregnancy precautions include avoiding contact sports or sports that carry a risk of falling, like horse riding. Go to the dentist. It might not be pleasant, but taking care of your teeth can actually lead to a healthier pregnancy. Women who develop gingivitis during pregnancy have a higher risk of complications, including preterm birth. Second trimester pregnancy symptoms at 15 weeks. Your pregnancy symptoms may include swollen and bleeding gums, pains on the side of your belly, caused by your expanding womb, known as round ligament pains, headaches, nosebleeds, feeling bloated, indigestion and heartburn, sore breasts, leg cramps, feeling hot, dizziness, swollen hands and feet, urine infections, vaginal infections, darkened skin on your face or brown patches. This is known as cloasma or the mask of pregnancy. Greasier, spotty skin, thicker and shinier hair. You may also experience symptoms from earlier weeks, such as morning sickness, a heightened sense of smell, mood swings, a white milky pregnancy discharge from your vagina, and light spotting. Seek medical advice for any bleeding.
The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin, it's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled shoes. Dizziness. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches.
17 weeks baby development. How big is your baby at 17 weeks pregnant? The baby is around 5.1 inches this stage. This is roughly the size of a potato. The skin is loose and wrinkled and the fetus has a lot of growing to do. By the time of the delivery, he or she will fill out their skin more normally. Around this stage of pregnancy, the fetus starts to look a lot more human. In addition to hair growing on the head, the eyebrows and eyelashes are also developing. The eyelids are shut, but the eyes themselves can move and the mouth can also open and close. The fingernails and toenails are growing, and your bundle of joy has also developed a firm grip. Your baby's been getting bigger and bigger over the last couple of weeks, and this means that he or she has needed a larger placenta. Remember that the placenta is the organ that supplies nutrition to the fetus, removes waste products, and fulfills other important roles. By the end of your pregnancy, the placenta will weigh around 510 grams. Your baby now has doubled in weight in the last 2 weeks. Fat begins to form, helping your baby's heat production and metabolism. The lungs are beginning to exhale amniotic fluid, and the circulatory and urinary systems are working. Your baby's bones. Your baby's skeleton is changing from soft cartilage to bone. Support your baby's bone health, and your own, by eating calcium-rich foods. Getting enough calcium also reduces your risk of hypertension and preeclampsia. The umbilical cord. The umbilical cord, your baby's lifeline to the placenta, is growing stronger and thicker. By the end of pregnancy, it will be approximately 9 inches long and 1 inch thick. The umbilical cord delivers nutrients to your baby and ferries away waste products. Your baby's skin. Sweat glands are starting to develop. And by next week, the layers of your baby's skin will be fully formed. Your baby when you're 17 weeks pregnant. Your baby is getting bigger all the time and might now weigh more than the placenta. Your baby is about 13 centimeters from head to bottom and about 150 grams. Your baby's external sex organs are completely formed. The kidneys are working, and your baby passes urine every 50 minutes or so. Your baby will also swallow some urine, which is sterile, in the amniotic fluid. This is normal. Loud noises might make your baby startle. Your baby's taste buds are working, and your baby can tell the difference between sweet and bitter. What does my baby look like? Your baby, or fetus, is around 12 centimeters long, from head to bottom, and weighs around 150 grams. That's roughly the size of a pomegranate and the weight of a ball of mozzarella. Your baby can move their eyes, although they'll stay shut for now. React to loud noises, open and close their mouth. Your baby's fingernails are starting to grow and will have their own unique fingerprints. Even identical twins have different fingerprints. Week 17, your second trimester. You might start to feel your baby move now. You will not be able to tell exactly what your baby's up to, but soon you could be feeling every kick, punch, hiccup and somersault. Your baby's movements. Many women spot the first signs of their baby moving between 18 and 24 weeks. Inside your tummy, you might feel bubbling, fluttering, rolling. You might find that your baby moves more after meals, when you listen to loud music, when you rub your tummy and talk to your baby, when you are relaxing. Here are some of the other symptoms you may be experiencing: tiredness and difficulty sleeping, swollen or bleeding gums, pain on the side of your belly, headaches, nosebleeds, bloating or constipation, indigestion. Baby development at 18 weeks pregnancy. At 18 weeks of pregnancy, your baby is developing at an incredible rate. During this stage of pregnancy, the baby's body is becoming more proportional, and the organs are maturing. The baby's bones are solidifying, and the baby is beginning to practice making facial expressions. The baby is now able to move in a more coordinated fashion. The baby is able to stretch, kick, and move its arms and legs. It may even be able to respond to external sounds and pressure, such as music or when you press on your abdomen. The baby's senses are developing at this stage of pregnancy as well. The baby's eyes are beginning to open and can detect light. The ears are also opening and allowing the baby to hear sounds from outside the womb. The baby has also developed taste buds and can now distinguish between sweet and sour flavors. The baby is beginning to produce surfactant, a substance that enables the lungs to expand and contract. This will eventually allow the baby to breathe on its own. The baby's hair, nails, and lanugo, the fine hair that covers the baby's body, are also developing. At 18 weeks, your baby is growing rapidly and developing new skills. Although it may be difficult to imagine, your baby is quickly becoming more and more like a newborn. As your baby continues to grow, you will be able to feel more and more of its movements inside your womb. By the end of this stage of pregnancy, you will be able to feel your baby's kicks, punches, and hiccups. Hello and welcome to our video on 19 weeks of pregnancy symptom and baby development. Congratulations on making it to the halfway point of your pregnancy. This is an exciting time as your baby continues to grow and develop, and you start to feel more and more like a mom-to-be. In this video, we'll cover what's happening with your baby and your body during the 19th week of pregnancy. Let's start with your baby's development. At 19 weeks, your baby is the size of a mango, measuring about 6 inches long and weighing around 8.5 ounces. This week, your baby's skin is getting thicker and more opaque, and you may even be able to see tiny veins underneath. Your baby's ears are also fully formed, and they can now hear your voice and other sounds from outside the womb. Your baby's brain is developing rapidly, and the neurons in their brain are now forming more complex connections. This means that your baby's movements are becoming more coordinated, and they may even start to play with their umbilical cord. Your baby is also starting to develop more defined facial features, including eyebrows and eyelashes. Now, let's talk about the symptoms you may be experiencing at 19 weeks pregnant. By this point, many of the early pregnancy symptoms have subsided, and you may be feeling more like yourself again. However, you may still be experiencing some common symptoms such as Braxton Hicks contractions. You may start to feel mild contractions in your uterus as early as the second trimester. These contractions are completely normal and help to prepare your body for labor. Increased appetite. You may find that you're hungrier than usual, especially as your baby's growth requires more energy. Back pain. As your baby grows and your belly expands, you may start to experience back pain. This is due to the extra weight you're carrying and the changes in your posture. Swollen feet and ankles. You may notice that your feet and ankles are starting to swell, especially if you've been standing or sitting for long periods of time. To reduce swelling, try elevating your feet whenever possible and wearing comfortable shoes. Skin changes. You may notice that your skin is becoming more sensitive or that you're developing new stretch marks. These changes are normal and can be managed with moisturizers or creams. In conclusion, at 19 weeks pregnant, your baby is growing and developing rapidly, and you may be experiencing some common symptoms like back pain, swelling, and skin changes. It's important to continue taking care of yourself by eating a healthy diet, staying active, and getting plenty of rest. Remember to schedule your next prenatal appointment with your healthcare provider and ask any questions or concerns you may have. Thank you for watching, and we'll see you in the next video. Hello and welcome to this video on 20 weeks of pregnancy symptoms and baby development. At 20 weeks, you're halfway through your pregnancy and your baby has reached an exciting milestone. So, let's dive into what to expect during this stage. Firstly, let's talk about the baby's development. At this stage, your baby is about the size of a banana, weighing around 10 ounces and measuring around 6.5 inches in length. They are now fully formed and all their major organs are in place. Your baby's skin is still thin and translucent, but they are beginning to develop a layer of fat to help regulate their body temperature. One of the most exciting developments during this stage is that you can now feel your baby's movements. Your baby is becoming more active and you might feel them kicking or moving around. As your baby grows, their movements will become more defined and frequent. Now, let's move on to the symptoms you might experience at 20 weeks of pregnancy. Firstly, many women experience increased appetite during this stage. 2. You may feel like you're constantly hungry and need to eat more often. This is because your body needs more energy to support your growing baby. Another symptom you may experience is heartburn or indigestion. As your uterus expands, it puts pressure on your stomach, which can cause acid reflux. To reduce this, try eating smaller, more frequent meals and avoid spicy or acidic foods. You may also experience some mild swelling in your feet and ankles. This is because your body is retaining more water during pregnancy. To reduce swelling, try resting with your feet elevated and avoid standing or sitting for long periods of time. One of the most common symptoms of pregnancy at 20 weeks is back pain. As your uterus grows, it puts pressure on your back and can cause discomfort. To reduce back pain, try using a pregnancy pillow to support your body while sleeping and avoid lifting heavy objects. Finally, you may experience some mood swings or heightened emotions during this stage. This is normal as your body is going through many changes, and it's important to take care of your emotional well-being as well as your physical health. In terms of prenatal care, it's important to attend all your scheduled appointments with your healthcare provider. At 20 weeks, you will have an ultrasound to check on your baby's growth and development. This is also when you may find out the sex of your baby if you choose to. In summary, at 20 weeks of pregnancy, your baby is fully formed and developing rapidly. You may experience symptoms such as increased appetite, heartburn, swelling, back pain, and mood swings. It's important to attend all your prenatal appointments and take care of your physical and emotional well-being. Thank you for watching this video on 20 weeks of pregnancy symptoms and baby development. We hope you found it informative and helpful. If you have any questions or concerns, please consult with your healthcare provider.
Sure, let us break down the key points for each trimester. First trimester, weeks 1-12, early signs and development overview of conception and early fetal development. Common symptoms like morning sickness, fatigue, and hormonal changes. Importance of prenatal vitamins and a healthy diet. Weeks 5-8, organ formation of vital organs and major body systems. Discuss potential early ultrasound and first heartbeat. Weeks 9-12, transition to second trimester, gradual reduction of some early symptoms. Introduction of prenatal screenings and tests. Second trimester, weeks 13-16, visible changes, baby's growth spurt and noticeable changes in the mother's body. Announcement of pregnancy to friends and family, week 17-20, gender reveal, discussion on when and how gender can be determined. Introduction of anatomy scan and potential genetic testing. Weeks 21-24, viability and quickening, fetal viability milestone. First experiences of fetal movements quickening. Third trimester, weeks 25-28, final trimester, begins overview of the home stretch. Importance of monitoring baby's movements. Weeks 29-32, preparing for labor, discussion on birthing classes and birth plans. Baby shower preparations and nesting instincts. Weeks 33-40, final preparations, physical and emotional changes in the mother. Signs of labor and when to contact healthcare provider. Packing hospital bag and finalizing birth plan. Postpartum, labor and delivery overview of labor stages and delivery options. Postpartum recovery and care for both mom and baby. Newborn care, basics of newborn care, feeding, and sleep. Emotional adjustments and potential postpartum support. Remember, this is just an outline. Feel free to expand on each point based on your audience and the depth you want to cover.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the third trimester, they will be able to hiccup. So, what can you expect during the rest of the third trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the third trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow between your knees to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the third trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class, which can help you feel more prepared and confident about labor and delivery. In addition to preparing for the birth, you'll want to start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29-week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained 5 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion: at 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy. Hello, and welcome back to our series on pregnancy. Today, we will be discussing week 31 of pregnancy and everything you need to know about your baby's development and your symptoms. So, let's get started. Baby development. At week 31, your baby is approximately 16 inches long and weighs around 3.5 pounds. Here are some of the key developments happening to your baby during this time. Rapid brain growth. Your baby's brain is growing rapidly during this time, which means that they will be able to process information more efficiently. Lung development. Your baby's lungs are almost fully developed at this point, and they are practicing their breathing movements. Sleep cycles. Your baby is now starting to have regular sleep and wake cycles. Baby fat. Your baby is putting on more baby fat, which helps regulate their body temperature after birth. Symptoms. As you enter the final trimester of your pregnancy, you may experience some new symptoms or the worsening of old ones. Here are some of the common symptoms that you may experience at week 31. Braxton Hicks contractions. You may start to experience Braxton Hicks contractions, which are mild contractions that help prepare your body for labor. Shortness of breath. As your uterus grows and pushes against your diaphragm, you may experience shortness of breath. Back pain. As your baby grows, the weight can put pressure on your back, causing discomfort. Swelling. You may experience swelling in your feet, ankles, and hands due to the increased fluid in your body. Heartburn. As your uterus grows, it can put pressure on your stomach, causing acid reflux and heartburn. Fatigue. As your body works hard to support your growing baby, you may feel more tired than usual. Frequent urination. Your baby's position may put pressure on your bladder, causing you to urinate more frequently. Tips for a healthy pregnancy. Eat a healthy diet. Make sure to eat a well-balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Stay hydrated. Drink plenty of water and other fluids throughout the day to stay hydrated. Exercise. Gentle exercise, such as walking or swimming, can help relieve some of your pregnancy symptoms and prepare your body for labor. Attend prenatal appointments. Regular prenatal appointments with your healthcare provider are essential to monitor your baby's growth and ensure a healthy pregnancy. Take childbirth classes. Childbirth classes can help prepare you and your partner for labor and delivery. Conclusion. At week 31 of pregnancy, your baby is continuing to grow and develop rapidly. You may experience some new symptoms or the worsening of old ones, but there are steps you can take to stay healthy and comfortable during this time. Remember to eat a healthy diet, stay hydrated, exercise, get plenty of rest, attend prenatal appointments, take childbirth classes, and practice relaxation techniques. With these tips, you can have a healthy and happy pregnancy. Thanks for tuning in, and we'll see you next time. Hello everyone, welcome to my YouTube channel. Today we will be discussing 32 weeks pregnancy and baby development, symptoms, tips, and healthcare. As a senior gynecologist, I have had years of experience helping women through their pregnancy journey. So, without further ado, let's get started. Baby development. At 32 weeks, your baby is about the size of a large jicama, measuring around 16.7 inches long and weighing about 4 pounds. Your baby's eyes are now fully formed and can open and close them. The bones in your baby's skull are not yet fused, which allows for easier passage through the birth canal during delivery. Your baby's immune system is starting to develop, and they are producing white blood cells to help fight off infections. Your baby's lungs are also continuing to develop and produce surfactant, a substance that helps keep the air sacs in the lungs from sticking together. Symptoms. At 32 weeks, you may experience increased back pain and discomfort as your baby continues to grow and put pressure on your back and pelvis. You may also experience increased fatigue and difficulty sleeping due to the physical strain of pregnancy. Braxton Hicks contractions, or practice contractions, may become more frequent as your body prepares for labor. Heartburn and indigestion may also become more common as your baby continues to push up on your stomach. Swelling in your feet and ankles may become more pronounced as your body retains more fluids. Tips. To help alleviate back pain, try using a pregnancy pillow to support your belly and lower back while sleeping. Practice good posture and avoid standing or sitting in the same position for too long to help prevent back pain and swelling. Stay hydrated and try to keep your feet elevated as much as possible to reduce swelling. To help manage heartburn and indigestion, try eating smaller, more frequent meals and avoid foods that trigger symptoms. Make sure to stay active and get regular exercise, such as walking or prenatal yoga, to help maintain your overall health and prepare your body for labor. Healthcare. At 32 weeks, you will typically have a prenatal visit with your healthcare provider to check on your baby's growth and development. Your healthcare provider may also perform a Group B Streptococcus (GBS) test to check for the presence of bacteria that can be harmful to your baby during delivery. It is important to continue taking any prescribed prenatal vitamins and medications as directed by your healthcare provider. In conclusion, 32 weeks is an important milestone in your pregnancy journey. Your baby is continuing to develop and grow, and you may experience new symptoms and challenges. Remember to practice good self-care, stay active, and attend all scheduled prenatal appointments to ensure a healthy pregnancy and delivery. Thank you for watching, and I'll see you in the next video. Hello everyone. Today, we will talk about the 33 week of pregnancy and the development of the baby at this stage. We will also discuss some common symptoms that mothers experience during this period and tips for taking care of their health. Baby development. At 33 weeks, the baby is about 17 inches long and weighs around 4 pounds. The baby's lungs are still developing and producing surfactant, a substance that helps the lungs expand and contract properly after birth. The baby's brain is rapidly developing, and they can now sense light and dark. The baby's bones are hardening, and they are gaining more fat under their skin, which will help regulate their body temperature after birth. The baby's movements are becoming more coordinated, and they can respond to sound. Symptoms. Braxton Hicks contractions. These are practice contractions that help prepare the uterus for labor. They can be uncomfortable, but are usually not painful. Backaches. As the uterus expands, it puts pressure on the lower back, causing discomfort. Shortness of breath. The growing uterus can also put pressure on the diaphragm, making it harder to breathe. Fatigue. As the body works harder to support the growing baby, mothers may feel more tired than usual. Swelling. The body retains more water during pregnancy, causing swelling in the feet, ankles, and hands. Tips for health care. Continue to eat a healthy and balanced diet, including plenty of fruits, vegetables, and protein. Stay hydrated by drinking plenty of water and avoiding sugary or caffeinated beverages. Exercise regularly, but avoid strenuous activities that could put too much strain on the body, Sleep on your side, preferably the left side, to improve blood flow to the baby and reduce the risk of stillbirth. Attend all prenatal appointments and communicate any concerns with your healthcare provider. Preparing for birth. Start thinking about a birth plan, including preferences for pain management and delivery options. Consider taking childbirth classes to learn about the labor process and techniques for coping with pain. Pack a hospital bag with essentials for both mother and baby, including clothing, toiletries, and a car seat. Talk to your healthcare provider about the signs of labor and when to call or go to the hospital. Conclusion. As you approach the end of your pregnancy journey, it is important to take care of yourself and your growing baby. Remember to listen to your body, attend all prenatal appointments, and communicate any concerns with your healthcare provider. By taking these steps, you can help ensure a healthy and safe delivery for both you and your baby. Thank you for watching, and I wish you all the best in your pregnancy journey. Hello everyone, we are going to discuss pregnancy at 34 weeks. At this stage, your baby is approximately 18 inches long and weighs around 4.5 pounds. Your baby's organs are fully developed, and they are continuing to gain weight and grow. Braxton Hicks contractions. These are practice contractions that your body goes through as it prepares for labor. They can be uncomfortable, but are usually not painful. Shortness of breath. As your baby continues to grow, it can push against your diaphragm and make it harder to breathe. You may notice that you need to take more frequent breaks or rest periods. Pelvic pain. As your baby moves into the birth canal, you may experience discomfort or pain in your pelvic area. Swelling. Many women experience swelling in their feet and ankles during pregnancy. Make sure to elevate your feet when possible and stay hydrated. Gestational diabetes. This is a type of diabetes that develops during pregnancy. If you are diagnosed with gestational diabetes, your doctor may recommend a special diet and monitoring your blood sugar levels. Preeclampsia. This is a potentially serious condition that can develop during pregnancy, characterized by high blood pressure and protein in the urine. If you experience symptoms like severe headaches, vision changes, or abdominal pain, contact your doctor immediately. Fetal movement. You should continue to monitor your baby's movements and contact your doctor if you notice any significant changes. Now, let's talk about some tips for taking care of yourself during this stage of pregnancy. Rest. As your due date approaches, make sure to get plenty of rest and sleep. This will help you conserve your energy for labor and delivery. Stay hydrated. Drink plenty of water and avoid sugary or caffeinated drinks. Exercise. Gentle exercise like walking or prenatal yoga can help you stay healthy and prepare your body for labor. Kegel exercises. These exercises can help strengthen your pelvic floor muscles and prepare your body for childbirth. Prenatal classes. Consider taking a prenatal class to learn more about childbirth, breastfeeding, and newborn care. Pack your hospital bag. Start packing your hospital bag with essentials like clothes for you and your baby, toiletries, and important documents. Talk to your doctor. Make sure to keep your doctor updated on any symptoms or concerns you may have. Finally, let's talk about your baby's development at 34 weeks. Baby's lungs. Your baby's lungs are almost fully developed, and they are practicing breathing movements in preparation for birth. Body fat. Your baby is continuing to gain weight and develop body fat, which will help regulate their body temperature after birth. Sleep and wake cycles. Your baby may start to have regular sleep and wake cycles, which can help prepare them for life outside the womb. Head down position. Most babies will move into the head down position in preparation for delivery. Overall, pregnancy at 34 weeks is an exciting and important time as you prepare for the birth of your baby. Remember to take care of yourself and stay in touch with your doctor as you get closer to your due date. Thanks for watching, and I'll see you in the next video. 35 weeks pregnancy. Baby development and symptoms. Welcome back to our channel, where we explore the incredible journey of pregnancy. Today, we're going to dive into the exciting world of 35 weeks of pregnancy. At this stage, your baby is rapidly developing, and you may be experiencing various symptoms. So let's get started. Baby's development. Your baby now weighs around 5.5 to 6 pounds and measures about 18 inches from head to toe. The baby's organs and systems are nearly fully developed, and the lungs continue to mature. The skin is becoming smoother as the fat layers continue to fill out. Your baby's brain is rapidly growing, and the nervous system is maturing. The baby's bones are fully formed but are still flexible to ease the birthing process. Symptoms you may experience. Braxton Hicks contractions. You may experience more frequent and intense practice contractions, which can help prepare your body for labor. Shortness of breath. As your uterus expands, it pushes against your diaphragm, making it harder to take deep breaths. Increased vaginal discharge. It's common to have a thicker and heavier discharge at this stage, but consult your doctor if it's accompanied by itching, burning, or a foul odor. Pelvic discomfort. The growing baby puts pressure on your pelvis, leading to pelvic pain or discomfort. Frequent urination. The baby's position and size may put pressure on your bladder, causing the need to urinate more often. Trouble sleeping. Finding a comfortable position becomes more challenging, and you may experience pregnancy-induced insomnia. Heartburn and indigestion. Hormonal changes and the baby's position can lead to increased acidity and digestive issues. Self-care tips for this stage. Rest and sleep. Listen to your body and prioritize getting enough rest and sleep. Exercise. Engage in gentle exercises like walking or prenatal yoga to stay active and relieve discomfort. Pelvic floor exercises. Strengthen your pelvic floor muscles by practicing Kegel exercises. Maintain a healthy diet. Focus on well-balanced meals that include fruits, vegetables, lean proteins, and whole grains. Stay hydrated. Drink plenty of water throughout the day to prevent dehydration and assist with digestion. Use proper body support. Invest in a maternity support belt or pillow to help alleviate back and pelvic pain. Practice relaxation techniques. Deep breathing exercises, meditation, or prenatal massages can help reduce stress and promote relaxation. Prepare for breastfeeding. Attend breastfeeding classes, educate yourself about proper latch techniques, and gather essential supplies. And that wraps up our exploration of 35 weeks of pregnancy. Remember, every pregnancy is unique, and if you have any concerns or questions, consult your healthcare provider. Stay tuned for more exciting updates on the journey of pregnancy. Don't forget to like, subscribe, and hit that notification bell to never miss an episode. Take care, and we'll see you next time. Greetings and welcome back to our Pregnancy Journey series. Today, we're diving into the incredible journey of the 36th week of pregnancy. As your due date gets closer, both you and your baby are experiencing some remarkable changes. Let's explore the symptoms you may encounter and the exciting developments happening to your little one. Maternal symptoms at 36 weeks. Increased discomfort. Your baby's growth puts additional pressure your abdomen, causing discomfort and backaches. Frequent urination may persist as your baby continues to press on your bladder. Shortness of breath can occur due to limited space for your lungs. Braxton Hicks contractions. These contractions, also known as practice contractions, become more noticeable and frequent. They help prepare your body for labor, but they are usually irregular and mild.